101. Prednisone is an immunosuppressant corticosteroid. True or false? Answer: true. Rationale: prednisone suppresses the immune response and inflammation, commonly used in autoimmune diseases. 102. Gentamicin is ototoxic and nephrotoxic. True or false? Answer: true. Rationale: gentamicin can cause damage to the kidneys and inner ear, requiring monitoring of drug levels and renal function. 103. Ranitidine is a proton pump inhibitor. True or false? Answer: false. Rationale: ranitidine is an H2 receptor antagonist, not a PPI. It reduces acid production, but through a different mechanism. 104. Diazepam can cause respiratory depression when combined with alcohol. True or false? Answer: true. Rationale: both diazepam and alcohol are CNS depressants and can synergistically depress respiratory drive. 105. Lisinopril is an angiotensin receptor blocker, ARB. True or false? Answer: false. Rationale: lisinopril is an ACE inhibitor, not an ARB. It inhibits conversion of angiotensin I to II. 106. Bupropion is contraindicated in patients with a seizure disorder. True or false? Answer: true. Rationale: bupropion lowers the seizure threshold and should not be used in individuals with seizure disorders. 107. Diphenhydramine is a first-generation antihistamine that causes sedation. True or false? Answer: true. Rationale: diphenhydramine crosses the blood-brain barrier and causes sedation, unlike second-generation antihistamines. 108. Hydrochlorothiazide can cause hyperkalemia. True or false? Answer: false. Rationale: thiazide diuretics like hydrochlorothiazide can cause hypokalemia due to increased potassium excretion. 109. Buspirone has a high potential for addiction. True or false? Answer: false. Rationale: buspirone is a non-benzodiazepine anxiolytic with low abuse and dependence potential. 110. Iron supplements should be taken with milk to improve absorption. True or false? Answer: false. Rationale: calcium in milk interferes with iron absorption. Iron is best taken with vitamin C or on an empty stomach. 111. Amiodarone is used to treat both atrial and ventricular arrhythmias. True or false? Answer: true. Rationale: amiodarone is a broad-spectrum antiarrhythmic effective against multiple types of arrhythmias. 112. Tamsulosin is used to treat benign prostatic hyperplasia, BPH. True or false? Answer: true. Rationale: tamsulosin is an alpha-1 blocker that relaxes prostate and bladder neck muscles, improving urine flow. 113. Methyldopa is safe for managing hypertension during pregnancy. True or false? Answer: true. Rationale: methyldopa is one of the preferred antihypertensive agents for use in pregnancy due to its safety profile. 114. Diltiazem is contraindicated in patients with heart block without a pacemaker. True or false? Answer: true. Rationale: diltiazem can worsen conduction defects in heart block, especially without a pacemaker. 115. Sucralfate requires an acidic environment to be effective. True or false? Answer: true. Rationale: sucralfate forms a protective barrier on ulcers in acidic environments. Antacids reduce its effectiveness. 116. Rifampin may cause orange discoloration of body fluids. True or false? Answer: true. Rationale: rifampin is known to turn urine, sweat, and tears orange, which is a harmless but notable side effect. 117. Captopril can cause a persistent dry cough. True or false? Answer: true. Rationale: ACE inhibitors like captopril increase bradykinin levels, which can cause a dry cough. 118. Levodopa is used to treat symptoms of Parkinson's disease. True or false? Answer: true. Rationale: levodopa replenishes dopamine levels in the brain, improving motor symptoms of Parkinson's disease. 119. Teratogenic drugs are safe during the first trimester of pregnancy. True or false? Answer: false. Rationale: The first trimester is a critical period for fetal organ development. Teratogenic drugs can cause birth defects. 120. Serotonin syndrome is a potential complication of combining SSRIs and MAO inhibitors. True or false? Answer: true. Rationale: concurrent use of SSRIs and MAOIs can lead to serotonin overload, resulting in serotonin syndrome, a life-threatening condition. 121. Warfarin therapy requires regular monitoring of INR levels. True or false? Answer: true. Rationale: warfarin affects blood clotting, so INR must be monitored to ensure therapeutic and safe dosing. 122. The antidote for benzodiazepine overdose is naloxone. True or false? Answer: false. Rationale: flumazenil is the specific antidote for benzodiazepine overdose. Naloxone is used for opioid overdose. 123. Glipizide is an oral antidiabetic drug that stimulates insulin secretion. True or false? Answer: true. Rationale: glipizide is a sulfonylurea that increases pancreatic insulin secretion, used in type 2 diabetes. 124. A side effect of nitroglycerin is headache. True or false? Answer: true. Rationale: nitroglycerin causes vasodilation, often leading to headaches as a common side effect. 125. Digoxin toxicity may present with yellow-green vision changes. True or false? Answer: true. Rationale: one hallmark symptom of digoxin toxicity is visual disturbances, such as yellow or green halos. 126. Omeprazole should be crushed before administration to enhance absorption. True or false? Answer: false. Rationale: omeprazole is enteric-coated to prevent degradation by stomach acid. It should not be crushed. 127. Loratadine is a sedating antihistamine. True or false? Answer: false. Rationale: loratadine is a second-generation antihistamine with minimal sedative effects compared to first-generation drugs. 128. Clopidogrel is used to prevent platelet aggregation. True or false? Answer: true. Rationale: clopidogrel inhibits ADP-mediated platelet aggregation, reducing the risk of clot formation. 129. Insulin glargine has a peak effect 2 hours after administration. True or false? Answer: false. Rationale: insulin glargine is a long-acting insulin with no pronounced peak, providing steady action over 24 hours. 130. Theophylline toxicity may cause seizures and arrhythmias. True or false? Answer: true. Rationale: theophylline has a narrow therapeutic range, and toxicity can lead to CNS stimulation and cardiac disturbances. 131. Furosemide is a potassium-sparing diuretic. True or false? Answer: false. Rationale: furosemide is a loop diuretic that promotes potassium loss. It is not potassium-sparing. 132. A major side effect of haloperidol is extrapyramidal symptoms. True or false? Answer: true. Rationale: haloperidol, a typical antipsychotic, often causes movement disorders like dystonia and akathisia. 133. Acetaminophen overdose primarily affects the kidneys. True or false? Answer: false. Rationale: acetaminophen overdose leads to liver toxicity, potentially resulting in hepatic failure. 134. Metoprolol may mask symptoms of hypoglycemia. True or false? Answer: true. Rationale: beta blockers like metoprolol can blunt signs of low blood sugar, such as tachycardia. 135. Fluoxetine is classified as a selective serotonin reuptake inhibitor, SSRI. True or false? Answer: true. Rationale: fluoxetine is an SSRI that increases serotonin levels to treat depression and anxiety. 136. Nifedipine may be used to manage preterm labor. True or false? Answer: true. Rationale: nifedipine, a calcium channel blocker, relaxes uterine muscles and can delay labor. 137. Metformin can cause lactic acidosis in patients with renal impairment. True or false? Answer: true. Rationale: impaired kidney function can lead to metformin accumulation and increased risk of lactic acidosis. 138. Salmeterol is used for acute asthma attacks. True or false? Answer: false. Rationale: salmeterol is a long-acting beta agonist, not suitable for immediate relief of asthma symptoms. 139. Vancomycin must be infused slowly to avoid red man syndrome. True or false? Answer: true. Rationale: rapid infusion of vancomycin can cause flushing, rash, and hypotension due to histamine release. 140. Phenytoin can cause gingival hyperplasia as a side effect. True or false? Answer: true. Rationale: chronic phenytoin use often results in overgrowth of gum tissue, especially with poor oral hygiene. 141. Isotretinoin is safe to use during pregnancy. True or false? Answer: false. Rationale: isotretinoin is highly teratogenic and contraindicated in pregnancy due to risk of severe birth defects. 142. Enoxaparin is administered intramuscularly. True or false? Answer: false. Rationale: enoxaparin is a low molecular weight heparin administered subcutaneously, not intramuscularly. 143. Acetylcysteine is an antidote for acetaminophen overdose. True or false? Answer: true. Rationale: acetylcysteine replenishes glutathione stores and prevents liver damage after acetaminophen overdose. 144. Tetracycline should be taken with dairy products for best absorption. True or false? Answer: false. Rationale: dairy products interfere with tetracycline absorption by forming insoluble complexes. 145. Levothyroxine is best taken with food to reduce gastric irritation. True or false? Answer: false. Rationale: levothyroxine should be taken on an empty stomach for optimal absorption. 146. Fluticasone is an inhaled corticosteroid used in asthma management. True or false? Answer: true. Rationale: fluticasone reduces airway inflammation and is used regularly to prevent asthma exacerbations. 147. Risedronate should be taken lying down to aid absorption. True or false? Answer: false. Rationale: bisphosphonates like risedronate must be taken upright to prevent esophageal irritation. 148. A serious side effect of clozapine is agranulocytosis. True or false? Answer: true. Rationale: clozapine can severely suppress white blood cells, requiring regular monitoring of WBC and ANC. 149. Docusate sodium is a stimulant laxative. True or false? Answer: false. Rationale: docusate sodium is a stool softener, not a stimulant. It promotes easier bowel movements by softening stool. 150. Zolpidem is used to treat insomnia. True or false? Answer: true. Rationale: zolpidem is a non-benzodiazepine sedative hypnotic used for short-term treatment of sleep difficulties.